Hi everyone, welcome back to Practical Pam. How's everyone doing today? Are you ready for a new lesson? Today we have a very interesting topic. Before we get started, let's make sure you have your Medicine 101 handouts printed and ready so you can follow along with me. The link is in the description. Also, if you're new here, welcome. I'm Practical Pam, and I'm here to answer common queries for the growing mind. We also provide worksheets to help retain our lessons and challenge our viewers with Practical Pam's Project of the Week. If you'd like to stay notified about this show or any other show on the Best Brains channel, like Shakespeare Speaking the Speech or Famous Kids in History, click subscribe. Do you have your handout and your pencil ready? Then let's get started. Today's topic is medicine. Most people need medicine at least once in their lives. But what is medicine and how does it work? How are the medicines we keep around the house different from the ones we can get at the pharmacy? Let's find out. Medicine is defined as a compound or preparation used for the treatment or prevention of disease, especially a drug or drugs taken by mouth. Medicine can also mean the science or practice of the diagnosis, treatment, and prevention of disease. Today we'll be focusing more on the compounds and treatment side of medicine. First of all, let's keep in mind that drugs and medicines have some differences. All medicines are drugs, but not all drugs are medicines. To be considered medicine, the purpose of a particular drug must be to prevent, alleviate, or cure a symptom, ailment, or disease state. In other words, the purpose of a medicine is benign. It's both made and regulated by our governments to have a positive medical effect on a patient. Medicine also tends to have many different components. In addition to the active ingredient, medicines also contain other substances called excipients that assist in the formulation and efficacy of that medicine for the patient. Many drugs that are legal today got their start as supposed medicines, and only after years of testing was it found that these drugs did harm to their patients, or at least more harm than good. A couple drugs are still used in modern medicine, but in very controlled circumstances, usually applied topically as a numbing agent, rather than being ingested where it can harm the body. Something important to remember is that even though medicines can have positive effects on us when we're sick, it doesn't make them safe to take when we're well. And different medicines are only useful for certain illnesses. Just because taking one kind of medicine made you feel better in the past doesn't mean it will work the next time you're sick. Only a doctor, nurse practitioner, or a pharmacist can determine which medicines you should take, how much you should take, and how often. Following these instructions exactly is the only way to make medicines effective. Even then, some medicines can have negative consequences as they help your body overcome an illness. They may make you feel very sleepy or make it hard to think. They may make you feel very chilly or sick to your stomach. It's important to remember that receiving treatment and being healthy are two different things. If you're taking medicine, be aware of your limitations, and don't be afraid to speak up if you feel uncomfortable, need to rest, or want some time alone. Now that we've established what medicine is, let's turn our attention to some of the most common medicines, the ones you're most likely to have in your home. Medicine should be stored in a cool, dry place, preferably where they're easily accessible. Other items used in health management like bandages, hydrochloric acid, braces, and sanitizing wipes should all be stored together. That way, when you need them, you know exactly where to go to get them, saving you valuable time. Many medicines we keep around the house have expiration dates. Just like food, the chemical compounds contained in the medicine can break down over time. Every medicine should be labeled with its expiration date. A lot of people like to write that date very large with a black marker on the package, so they know when it's time to replace the expired medicine with a new package. Medicines that you don't need a prescription for are called over-the-counter. Medicines that require a prescription are kept in the pharmacy. Also, certain over-the-counter medicines are kept there too for safety. If you can't find a particular medicine or dietary supplement, like a vitamin or a probiotic you're looking for, the pharmacist and their assistants can come out and help you look in the aisles. Remember, even if you don't have a prescription, you can ask the pharmacist or their assistants for advice. They are trained specifically to handle medicine and understand what every kind of medicine does, even over-the-counter medication. Let's go over some common over-the-counter medicines and see what they do. First, let's look at the pain relief medicines. These are medicines which can help lessen pain in the body, like sore muscles from exercise, headaches, burns, and sore feet and joints. Some people who have chronic pain, a pain in their body which never goes away, take these medicines daily as part of their pain management. This is something they would talk about with their doctor before doing. It's okay to take some pain relief pills once in a while when you have aches and pains, but taking them regularly needs a doctor's approval. Pain relief medicine usually comes in pill or gel form, and sometimes the gel is held in a digestible capsule. That way you don't have to measure any liquids. There are two main types of over-the-counter pain relief. Acetaminophen is the first type. Acetaminophen reduces fever and relieves pain caused by muscle aches and stiffness by affecting the part of your brain that receives pain signals from the body. It's important to remember that acetaminophen is not healing your headache or muscle pains. It is simply making your brain less receptive to the pain you're feeling. The other type of pain relief medicine is called NSAIDS, or non-steroidal anti-inflammatory drugs. Quite a mouthful. These include ibuprofen and naproxen. NSAIDs reduce fever and relieve pain as well, and also help reduce swelling and irritation, which we call inflammation. NSAIDs relieve pain by reducing the production of prostaglandins, which are hormone-like substances that cause pain. Again, this medicine is not healing you, but it is stopping your body from producing a painful chemical. Some people are not supposed to use NSAIDs if they have certain illnesses that make them more likely to bleed internally, since it can increase those risks. Let's talk about cough and cold medicines. These are designed to affect the symptoms of colds and flus, like coughing, stuffy nose, and sneezing. Many cough and cold medicines also include acetaminophen, ibuprofen, or naproxen, so always read the label to make sure you aren't double dosing on those. Coughing, stuffy nose, and sneezing are generally caused by excess mucus production. Mucus is made in the nose and drips down into the throat and lungs, making you cough. Mucus can also fill your airways, making it harder to breathe. The most common type of cough and cold medicine is a decongestant, usually in the form of a pill or a spray. Decongestants shrink swollen blood vessels in the nose to relieve congestion. Antihistamines are another medicine people take for stuffy noses, but usually due to allergies. Antihistamines block a chemical that makes your nose fill up and run. Notice that these two medicines aren't fighting the infection that is causing your nose to be stuffed up or your body to produce mucus, but they are stopping your body from producing an excess of mucus. Cough medicines often contain different chemicals designed to lessen your coughing. They may work on reducing the compulsion to cough, loosening mucus to help keep your airways clear, or contain decongestants and antihistamines. Cough drops often have a numbing effect when swallowed to help with the scratchy feeling that makes you want to cough. Let's take a look at medicines that help your GI or gastrointestinal tract. This is the path that food takes through your body, and at every step along the way, you can experience pain and discomfort. Heartburn happens when your stomach acids enter your esophagus, usually if the entrance to the stomach isn't closing properly or the stomach is too full. This acid hurts parts of the body that aren't the stomach, which is lined with mucus to protect it. While acid burns have to heal over time, we can take antacids to counter the acid in our stomachs until they calm down again. Alinic acids create a barrier when swallowed to prevent further burning. When we experience nausea, that queasy feeling from an upset stomach, we can take medicines that either help increase our stomach lining or block messages from reaching the part of the brain that controls nausea and vomiting. These medicines are also good in combating motion sickness caused by flying or being on a boat. While GI medicines do more to treat problems than cough and cold or pain medicines do, we need to remember that sometimes GI pain and sickness isn't just caused by too much ice cream. Tell your parents or guardians if you have persistent nauseous feelings, regular vomiting, or changes in your bathroom behavior. It could be food poisoning or something more serious. So, as we've gone through these common over-the-counter medicines, you may have noticed a pattern. None of these medicines actually heal the body or treat any disease. Over-the-counter medication can only alleviate certain symptoms of being sick. They are not a cure. In fact, the reason we get sick at all is because our immune system is fighting an illness. We produce mucus so that we can rid the body of dangerous bacteria and viruses. We get a fever to make it more difficult for bacteria to reproduce in our bodies. Now, sometimes our immune systems can go too far, making our fever so high that it could hurt our brains, or making so much mucus that it's hard to breathe. In these cases, over-the-counter medication helps balance out your body. But in a lot of cases, taking these medicines can make you feel sick longer, since your body isn't fighting the infection at full strength. No one likes to be sick, which is why consulting a doctor, nurse practitioner, or pharmacist should always be the first thing you do before self-medicating. They may be able to properly diagnose your illness, recommend treatment, and prescribe different medicines that treat your illness and help your body fight it. In the meantime, the best thing you can do for your body is to treat it well. Get a good night's sleep so that you have time to reset and recharge for the next day. Eat fruits and vegetables and drink water throughout the day to keep hydrated and give your body good fuel to work properly. Make sure you walk every day to keep your blood flowing and body moving. Take good care of your body, and your body will take good care of you, even when you do get sick. There's so much more we could talk about regarding medicine, illness, and our health, but we're out of time. Do you have a question or suggestion for Practical Pam? You can send them to me at practicalpam@bestbrains.com. We'll see you next week with an all-new video. Remember to subscribe to the Best Brains YouTube channel. We have lots of great content coming out every week. Bye! Bye! Goodbye!